Hello dearies, it's Mabel again, your 70-year-old fountain of wisdom and sass. And today we're talking about something that makes more people groan than my ex-husband trying to dance. Ulcers. Yes, ulcers. Not the glamorous topic you wanted, but the one you need. Because these nasty little wounds are sneakier than a cat in the pantry. Now listen up. Ulcers are not just stomach aches that you can brush off with peppermint tea. And denial? They are actual open wounds in your stomach, your small intestine, or even your esophagus, that fancy word for your food tube. Think of it like a pothole on a road. Ignore it long enough and boom, the whole street is blocked, and the mayor is on television blaming the rain. Same with your insides. Ignore ulcers, and suddenly you have bleeding, infection, or even a hole straight through, which I promise you is not a fun DIY project. So how do these little monsters start, you ask? Well, your stomach is like a well-trained kitchen. It produces acid to break down food, and it also produces mucus to protect itself from that acid. Balance is key, like gin and tonic. Too much gin and you're in trouble. Too much acid or too little mucus and your poor stomach lining starts to erode. That is when ulcers appear. One of the main culprits is a cheeky bacterium called Helicobacter pylori, or H. pylori if you're not into tongue twisters. This bug moves in, throws a house party in your stomach lining, and weakens the protective barrier until the acid starts burning holes. The worst part, this bacteria can live there for years without showing a single symptom. Like an in-law who overstays their welcome until suddenly your kitchen is empty and your wallet too. By the time you feel pain, the damage may already be well underway. But wait, there's more. Because modern medicine has its villains too. Non-steroidal anti-inflammatory drugs, you know them as ibuprofen, aspirin, naproxen, those little pain relievers everyone pops like candy. Well, these drugs reduce prostaglandins. Those are compounds that help protect your stomach lining. So without them, your belly is as exposed as me in a swimsuit at the community pool. And trust me, nobody is safe in that situation. If you take these pills often, especially on an empty stomach, congratulations, you just signed up for the ulcer club, and membership is painful. Now, for decades, people blamed stress for ulcers. And while stress doesn't directly cause them, it sure loves to make them worse. Stress messes with digestion, boosts acid production, and slows healing. Add smoking and drinking to the mix, and your stomach doesn't stand a chance. Smoking reduces blood flow to the stomach lining, while alcohol pours acid on the wound and strips away the protective mucus, like peeling the paint off a wall before the rainstorm hits. Throw in a diet of junk food and fried nonsense, and darling, you're practically hosting an ulcer convention. Alright, enough causes. Let's talk about what it feels like when you've got one. Ulcers can be sneaky. Some people have them for years and don't notice until things get dangerous. But the classic sign is a burning or gnawing pain in your upper abdomen, usually between meals or at night. Sometimes eating helps for a little while, sometimes it makes it worse, depending on where the ulcer is hiding. If it's in the duodenum, that's the first part of your small intestine. You might feel pain a few hours after eating and feel better with food. If it's in the stomach itself, eating can make the pain worse. Other symptoms: bloating, burping, like a frog in a pond, poor appetite, and unexplained weight loss. Though, if I lost weight without trying, I'd throw a parade. But trust me, in this case, it's not the good kind of skinny. More severe cases can bring nausea, vomiting, or feeling stuffed after a few bites. And here comes the scary part. When ulcers bleed, you may vomit something that looks like coffee grounds, or you may see black tarry stools. Darling, that's not a trendy detox. That's internal bleeding, and you need a doctor right away. Chronic bleeding can also lead to anemia, so if you feel tired, dizzy, and paler than a ghost at a sunscreen festival, check yourself. The worst symptom is sudden, sharp abdominal pain spreading across the belly. This could mean a perforated ulcer, which is a hole in your stomach or intestine wall. When that happens, your insides start leaking into places they should never be, causing peritonitis, a severe infection that can kill you if not treated immediately with surgery and antibiotics. Not to scare you, but darling, this is not the time to wait it out with herbal tea. Now, how do doctors know if you have an ulcer? Besides your dramatic storytelling, they use tools. The gold standard is an upper endoscopy. That's when they slide a camera tube down your throat to peek at your stomach and small intestine. It sounds worse than it is, and honestly, I've had blind dates more uncomfortable than that. During the procedure, they can even take tissue samples to test for H. pylori or rule out cancer. If that sounds too scary, there are less invasive tests, like the urea breath test, stool antigen test, or blood antibody test, all of which check for H. pylori. Imaging like X-rays with barium can show larger ulcers, but they're not as accurate as endoscopy. Doctors will also ask about your medication history, especially if you've been popping NSAIDs or corticosteroids. because those can confuse diagnosis and treatment. And please, don't wait until you've been taking pain pills for 10 years before mentioning it. Doctors are good, but they're not psychic. Alright, now, the good news. Ulcers can be treated if you catch them before they turn your insides into Swiss cheese. The treatment depends on the cause. If H. pylori is involved, doctors prescribe antibiotics to kick the bacteria out, plus a proton pump inhibitor, a PPI, to reduce acid and let the ulcer heal. PPIs like omeprazole or lansoprazole are very effective and usually taken for several weeks. If the ulcer isn't caused by bacteria, acid-suppressing drugs are still key. H2 blockers like ranitidine can help, but PPIs are stronger. Antacids may give temporary relief, but they won't heal anything. They're like putting lipstick on a pig. Sometimes doctors use sucralfate, which coats the ulcer and protects it from acid, like wrapping your stomach in bubble wrap. If NSAIDs are to blame, the first step is stopping them. But don't quit cold turkey if you're taking them for chronic pain. Always talk to your doctor. They might switch your meds or add protective drugs. Surgery is rare nowadays, but if you have bleeding, perforation, or obstruction, you might need it. Sometimes bleeding ulcers can be treated during endoscopy by cauterizing the lacerations, but if it can't be controlled, surgery is the only option. And honey, emergency surgery is not the spa day you think it is, so prevention is better. Now here's my bottom line. Ulcers are not minor irritations. They are open wounds, and ignoring them can be fatal. Every year, people suffer because they brushed off symptoms or masked them with painkillers. Don't be that person. If you have burning stomach pain, nausea, unexplained weight loss, or dark stools, see a doctor. Once an ulcer forms, it doesn't magically disappear. It gets deeper, spreads, and weakens your stomach wall. Early diagnosis and treatment are life-saving, not optional. Understand how they form, how they present, and how they can be treated, and you'll save yourself a lot of misery, especially if you're at risk, like if you smoke, drink, take NSAIDs regularly, or had H. pylori exposure. Don't assume it's just heartburn. Don't wait it out, because the damage might already be happening. So, that's the story, my lovelies. Ulcers are serious, but knowledge is power, and power is what keeps us fabulous. Past 70, stay sassy, stay healthy, and remember, subscribe and share this video with someone who has sudden stomach pain. You might just save a life.